Anybody who loses a hearing, and also people who are hearing individuals, understand how important hearing is. If you lose your sight, you disconnect yourself from the world. If you lose your hearing, you disconnect yourself from the social interactions of those people around you. Helen Keller even said that she would rather be blind than deaf for that very reason.
The sense of hearing is what keeps you connected to the world around you. 24 hours a day, 7 days a week, it never shuts off. And it keeps us connected in our relationships.
There's a feedback loop to speech and language development. If you're born with normal hearing, you hear normally, and you hear it over and over and over again. You hear the same sounds, the same combinations, and then at about 9 months to a year, kids start to produce sounds. But if you don't hear it, you can't produce it.
You know, the normal way that we hear, sound waves come into the ear, they vibrate the eardrum and the ear bones. That vibration is transmitted to the fluid of the inner ear and is sensed by hair cells. You hear different frequencies along the cochlea, which is the nerve portion of your ear. It then generates an electrical signal that gets sent into the auditory nerve that goes into the brain and is initially processed as just sound information, and then the higher centers of the brain make it into understandable speech. The cochlear implant works through those neural pathways as well, but it bypasses all that outside portion, and it bypasses even the hair cell. We implant an electrode into the inner ear, and it generates a signal that directly stimulates the nerve of hearing.
Because you're not amplifying sound very loud and driving through an impaired system like the cochlea with the little hair sensory cells that are damaged, the quality of the sound when you tap directly into the auditory nerves, the spiral ganglion cells, tends to be much, much better. It's much clearer.
Most people's hearing loss is related to what we call hair cell loss. The cochlear implant doesn't care whether you have hair cells or whether they're functional. It actually bypasses the hair cells.
Big advantage of the implant over a hearing aid is you get better access to sound. So with hearing aids, you're limited by acoustics.
Well, a hearing aid and a cochlear implant are completely different things. A hearing aid is essentially for patients that have hearing loss that is anywhere from mild to potentially severe. Essentially what it does is it amplifies the outside sounds and sends them to the ear that is essentially able to continue to understand speech. As your hearing deteriorates, you lose the ability to do what we call discriminate speech. A hearing aid can't help that problem. So a cochlear implant is essentially for those patients who cannot really get reasonable benefit from a hearing aid.
I'm John Barber. I had perfect hearing until about the age of 25. And I was diagnosed at that point with a genetic disease called osteosclerosis that immobilizes the bones, and so sound is not transmitted from your eardrum to the cochlea and you lose your hearing. I went through many hearing aids of ever-increasing power and ever-increasing expense until finally, even with expensive and powerful hearing aids, my hearing was very marginal. At that point, I was evaluated and I became eligible to have an implant. And that implant was done almost 3 years ago.
In our Hillcrest setting here, we have the benefit that a lot of our patients are hearing aid patients, and the audiologists that work with them find that they can't fit them with hearing aids that are beneficial anymore. So then they refer them on for a cochlear implant evaluation with the doctor and with one of our cochlear implant audiologists.
Those patients can often be implanted and do very well and hear better with the implant than they have with their residual hearing and a hearing aid.
The Food and Drug Administration has set up certain criteria for people to qualify for cochlear implants.
We're looking for somebody who has primarily a severe to profound hearing loss, and it has to be in both ears. We generally don't implant a patient who has good hearing in one ear and say no hearing or very poor hearing in the other ear. Ability to understand words is probably the most important part of that. Generally, we're looking for a patient with anywhere from 30 to 40% understanding in the ear we're considering to implant. Once we determine based on their audiogram that they may be a candidate for cochlear implantation, we then do additional testing.
Criteria for pediatric patients is that you are at least 12 months of age, unless there's a compelling reason in terms of being able to implant earlier. You want to have no significant benefit from hearing aids. For very young kids, that is glean mostly from the speech-language therapist in terms of how are they doing with respect to speech and language development compared to their peers, and then by the audiologist by testing the booth to look to see what they have access to, what they can hear, what they can understand.
Once we determine that they are indeed a cochlear implant candidate, the patient has to make that decision. In a small child, obviously the parents will make that decision.
At least initially, when cochlear implants first became available, generally only one side was implanted. Now they are starting to implant two sides, and particularly with children.
In a small child, we generally do bilateral simultaneous implantation, meaning we actually do a surgery where we implant one side, we turn the patient over, and we implant the other side at the same sitting. If you look at the number of cochlear implant surgeries, there's about twice as many adults that are done than children, only because it's a much larger population, and there's a lot of patients who are going to lose their hearing with time.
Dr. Turner does do surgery on all ages. When children need a cochlear implant, their programming and everything is taken care of over by the audiologist at Children's Medical Center. Once they turn 18 now, they would be seen at our practice here. We do see a large range of age groups from 18-year-olds to people in their 90s who have gotten cochlear implants and have been successful users.
The age range at Children's, we see the largest number for cochlear implantation are very young kids. If they have a hearing loss, we want to have them fit with hearing aids at 3 months. And if they need a cochlear implant, we want to be able to have ascertained that by the time they're 12 months. And then we want to move them forward with speech and language development past that 12 months.
My name is Ron Kerg. My wife Julie and I have 2 sons that have cochlear implants.
I'm Julie. This is Cooper. He's 2. What's your name? Your name's Isaac. You're 5.
Isaac, which is the older brother, he was screened at birth and actually passed his screening.
We started to realize that Isaac could not hear when he was probably around 16 to 18 months.
Mom suspected that he had a hearing loss because he just didn't seem to respond to sound at home.
He didn't really have a whole lot of vocabulary.
He eventually was tested by the audiologist at Children's Hospital, and they found that he was profoundly deaf.
Because of his hearing loss, his visual acuity, of course, was phenomenal. So we took him in for the test with Linda, and Linda said, I've been doing this 20 years, and the boy almost had me fooled. We tried hearing aids. They were ineffective.
After we went through all of the insurance, we were scheduled to have bilateral done in November. Isaac ended up having double ear infection on that date. So then we came back and we did one cochlear surgery on December 23rd, and then we did the next one in March of 2011.
So then when we found out we were pregnant with Cooper, of course, we had concerns.
We had already kind of had a thing with Linda where, she knew I was pregnant because we were going for Isaac's programming appointments. She just said, we'll do whatever needs to be done with this next one if we have to.
When he was born, he failed his hearing test right out of the gate. So we knew what to do.
So basically, as soon as we got out of the hospital, we set up an appointment with Linda to do the ABR.
We can identify these kids by what we call auditory brainstem response testing. We put 4 electrodes on, and by virtue of where those electrodes are placed, they pick up the tiny electrical charge in the brain in response to sound. So that's how we can tell, even though a child can't give us information about their hearing at a newborn stage, the brain can.
We had it done, less than a month after Cooper was born, and he failed it also.
Once we know there's hearing loss, we can begin the process of fitting hearing aids, getting kids to hear again. If we have children with severe to profound hearing loss, where if they're not successful with their hearing aids, we can then move them forward if the parents want with cochlear implantation and the benefits that it has.
We went through the whole hearing aids. They didn't work, so we got the ball rolling with Dr. Turner. We were ready to go right after Cooper turned a year. So he was able to have both of his ears done in August of 2012.
We try to implant about the age of 12 months in a congenitally deaf child or somebody who's born deaf, because you tend to get much better results by doing it early.
The benefit of implanting at 1 year of age is that you can tap into the natural process of speech and language development. We are set up to have the largest number of neurons for speech and language development between 6 months and 3 years of age. So if you can hear at that age, it's much easier for you to catch up if you've fallen behind a little bit and then move forward very quickly, because the brain is set up to do that. And outcomes are very good for children you implant young.
Isaac will be starting kindergarten at age 5, and all his teachers say, except for a little bit of speech, which is expected because he was a year behind. He turned 2 in November before he even had his first implant. we're very blessed that he's going to start kindergarten with his peers.
He is right on target with all the rest of his classmates. You know, there's certain issues that he has with his speech, but obviously his speech therapy has helped. He really is a smart kid, and I think from not being able to hear for that long, that has really, you know, made him a lot more alert and really catches on quick with everything. It really isn't any different than any child that would be considered typical at a school.
Hey, Cathy.
Hi.
How are you?
I'm good. How are you, Dr.
Doing well.
Good.
Okay, so we're having you come in to basically discuss the surgery for the cochlear implant. Cathy has had a long-standing hearing loss. She's worn hearing aids for years, but she's gotten to a point where she's having more and more difficulty with hearing. Therefore, mutually decided that it would be beneficial for her to think about doing a cochlear implant. We did the standard evaluation, and she failed it and was shown to meet criteria.
When I first found out that I qualified, I have to tell you, I was depressed. 2.5 years ago, I was tested, and I passed the test with flying colors. While I realized that my hearing loss had declined, I didn't think it had declined to the point where I would be qualified to have the surgery. And it was interesting because lots of people, when they first found out I qualified, they're like, well, aren't you excited? And I'm like, well, no, not really, not at this point. And then after I had some time to process it, I got to the point where I started to become excited and, you know, was looking forward to being able to understand my children, my grandchildren, my close friends and family and coworkers, etc. And now I'm at the point where I'm getting a little bit anxious because it's just 3 days away.
Anytime you make a decision to have a surgical procedure, you're going to have some hesitation in relation to that. And I think the potential benefits of it are such that people, at least my experience has been that people don't have that much problem deciding to go ahead with the cochlear implant because especially people who've lost their hearing with time are not very functional.
There are risks involved with the surgery, and I really will, allow Dr. Turner to more fully explain those to you. But honestly, for many, many years, ever since I've been doing the work that I've been doing, I've always felt like if I ever reached that point where I qualified, I would go ahead and have the surgery.
Any sort of surgical procedure has potential risks associated with it, and cochlear implant has risks as well. We need to go through the bone behind your ear. We need to go between two separate nerves. One of those nerves is the taste nerve, and that provides taste sensation in the front part of your tongue. There's another nerve that's below that nerve, and that's the nerve that gives you function to one half your face. We protect that nerve, of course, during the procedure. We also monitor that nerve during the procedure, so the likelihood of actual damage to that nerve that would be permanent is very, very small.
Okay.
Your inner ear is also your balance mechanism, and some people will have some dizziness. Also, because your inner ear connects to the brain, if you had an infection that got through the device, you could get meningitis, although it's a very small risk, and we do recommend you get immunization against the common bacteria that cause meningitis. The cochlear implant works by being inserted into the cochlea, and so any sort of residual hearing that you have generally will not typically survive the operation, so you can't go back to a hearing aid after cochlear implantation.
Okay.
Our expectation of success, however, is much better than you're doing now, so that is obviously an advantage as far as your hearing is concerned. We're able to do this as an outpatient procedure, so you get to go home the same day. You'll have a dressing on that generally we let you take off the following day. And we do want you to, of course, take it easy. We don't want you to do a whole lot of, vigorous type activities afterwards.
Okay. After the surgery, I will go see Dr. Turner for a post-op appointment. As far as recuperation is concerned, I've been told to expect possibly dizziness for a week or two, which may impact my ability to drive. The pain I was told to expect was anywhere from mild to moderate. They do make, an incision behind your ear. I plan on taking 7 days off of work, but actually I was told, the surgery is on a Thursday, and I was told I could go back to work Monday, assuming that I was not taking pain medication or dizzy. So, I mean, that's a pretty quick turnaround time, recovery time there.
We do what we call hookup or initial stimulation about 3 weeks after surgery so that everything has time to heal before we put the external equipment and the speech processor on the outside.
There's not a magic time that we can go ahead and do a hookup. The device is actually functional the day that you put it in. One of the limitations and the reasons why we don't immediately go and hook up a patient is that they sometimes will have some swelling. And if you are swollen over the area where you have to put the outside antenna, it may not be able to communicate with the internal device. So in general, most people will do the hookup anywhere from 3 to 5 weeks. We try to shoot for 3 weeks because the sooner the patient has hearing, the better for that individual.
Yeah, for 3 to 4 weeks, for that time that is required for healing to take place, I will be deaf in that ear.
Questions at all?
Another thing I've got to ask you is stitches. Are these going to be dissolvable?
We put absorbable stitches deep in, and then we use basically super glue on the outside.
Okay.
So you won't have any stitches that need to be removed.
Okay.
Actually, the super glue makes a much nicer looking wound than stitches do anyway. So.
Okay.
Okay. I got to mark your ear. Right. Yes. Also.
All right, now this is what we call our kissing point. So she gets to get a little shorter. So you have to keep it short. Love each other. Short. There you go. Thank you. You're welcome. God bless you. We're going to back in. Okay? I'm going to give you the sleepy medicine. One more big deep breath.
This is a left Cochlear implant on Mary Kooser. So we locate what's called a mastoid tip. I'm going to make an incision a little bit behind the ear. Now we basically elevate what's called the periosteum, which is the lining on the top of the bone to expose the actual bare bone of the skull. So we're going to mark the center of where we want to drill a little hole, and then we're going to mark where our electrodes are going to go. So now we are going to drill our mastoid. I like to inset the device, makes it less prominent for the patient. We actually irrigate this whole thing with antibiotic solution, and there we go. So we now have a hole into the cochlea where we're going to put our electrode. So here's our internal device that we're going to implant into the patient. It has an antenna to communicate with the outside, a magnet to keep the headpiece on. This is the electronic package, and this particular device, which is a nucleus freedom device, has 2 electrodes, the stimulating electrode with 22 channels and a ground electrode right here, which allows the stimulating electrode to work. So we're going to put the device up in our pocket till it sits into our little hole that we drilled, as you can see. And this is our stimulating electrode, which is what we put into the cochlea itself. And we basically want to insert this so the electrodes are facing the nerves of the cochlea. So now we can see that the electrode went through that little opening we made into the cochlea. There's a lot of excess of these electrodes, so that if you put them in a little kid, as this device migrates, the electrode would essentially straighten out. So over the top of the device. Super glue. And there is indeed more than just an ear under there. There's a patient.
Can you hear me? Surgery's over. You're just waking up. Are you comfortable? Any pain? No pain? I'm going to go to the recovery room. Good luck to you.
Thank you for your help.
Bye-bye. How you doing?
Your ear hurts. My ear.
What did the doctor say?
Everything was perfect.
Huh?
Everything good.
It's very interesting that implants require a team. The first thing that's most important is that the doctor surgically gets the implant in correctly, all the electrodes are working, and the device heals normally. Once that's in, that sort of starts the long process of developing speech and language, because having the implant in your head does not make you hear.
The rehabilitation essentially comes from the cochlear implant audiologist.
So the team of Turner and Mary Beth did an excellent job installing the implant and then managing the whole process afterwards. And that process afterwards is probably more important to the success of the whole thing than the actual implantation surgery.
What makes you hear is the addition of that speech processor. It's the external part of the device that's worn behind the ear with a little coil that couples to the inner ear. It's called the internal cochlear stimulator. We'll then figure out how much current you need to first hear a sound, and then when it's loud but comfortable across frequency, that in turn is called a map. A map is just a set of rules of how you're going to listen. And we refine that over time.
You know, we've all seen those videos on TV, you know, of the little ones that are implanted and they're, you know, so excited because they hear the noise for the first time. But, you know, I'm an adult and I have had hearing, so it's not like that. It's not going to be perfect right away. It takes time. It takes time for your brain to make that adjustment.
The way I explain it to people is if you had a leg amputated and got an artificial limb installed, you wouldn't run a marathon the next day. But that's not to say that at some point you would not run a marathon.
One thing about cochlear implantation that I always tell patients is that you're going to have to get used to it. You're going to have to give it an effort on your behalf to get used to it. Your signal originally from your inner ear was millions of these little hair cells sending tiny little signals in, and now we're using a very gross electrical signal to generate the same understanding. A lot of times in the beginning it'll sound sort of electronic to the patient. They'll often describe it sounding like Minnie Mouse. And a lot of the adjustment that people have to the cochlear implant comes from reprogramming inside the brain.
People don't tend to have great hearing or, you know, wonderful hearing the first day. It usually takes time for them to get used to it.
I feel that I'm still learning to hear with this prosthetic ear I have, and I don't anticipate that that process will stop for some time. I hear better now than I did last year, and I hear much better than I did 2.5 years ago when I first had it turned on.
What I'd like to do first of all is take a look at your incision site, just to make sure that everything looks okay before we attach anything to it. Yeah, looks good. Looks like it's healing just fine. Okay. So we're going to put this on. The first thing I'm going to do is run a test called impedances to check your internal device. Then after that, we're going to make you something called a map, which is what we use to program the speech processor, which is the outside part that you'll be wearing. We're going to go through a series of electrodes, and we're going to have you listen for some soft beeps. And then we will, what we call, go live or turn the speech processor on. So I'm going to go ahead and put this on. I'm just going to put this over your ear.
Okay, that feels strange.
Yeah.
Not quite the same as a hearing device.
No.
Yeah.
Yeah.
I should be able to adjust to this to where I'm not conscious of the fact that I'm wearing it.
We hope so. We
Okay.
hope so. That it'll get to the point where, you know, you'll put it on, and hopefully the same thing was like that with your hearing aid, where you just kind of put your hearing aid on. And we have people come back and say, well, I stepped in the shower with it because I forgot that it was on.
Oh, okay,
You know.
good.
Luckily, it's kind of waterproof-ish, so we want it to get to the point where it's one of the first things you want to put on in the morning and the last thing you take off at night,
Right.
just like your hearing aid.
So the next part is going to be similar to a hearing test then, or just with the beeps?
Yeah, kind of similar. Just listen for some soft beeps. There will be 3 soft beeps. And when you first hear the beeps, let me know.
Okay, I hear that.
Okay.
Down here, 3.
So we have our T levels or our threshold levels set. So now we're going to do what we call go live. So that means I'm going to turn the sound on, and you're going to get sound through the speech processor. Like I said, oftentimes people report that it's very noisy, in the beginning, and that will kind of calm down. If it's too much, if it's overwhelming, let me know. I'll turn it off, and then we'll adjust it as it needs to be.
My heart is pounding.
I'm
I feel
sure.
like I need to hold somebody's hand.
Yeah. I'm going to go ahead and start to turn my voice up, so that's be a little louder than the noise. Are you hearing?
I hear, but not your voice. I'm
Okay.
hearing your voice through this ear.
Okay.
It's really strange.
Okay. Okay. Can you tell us what you're hearing through the cochlear implant? When I talk to you, what does that sound like? Can you describe that for me? Okay.
I'm not hearing your voice through
Okay.
this cochlear implant.
Okay.
Robotish.
Sure. And that's
Very, very robotish with other noise there. Now starting to hear my own voice as I'm talking.
right.
Very, very weird.
Okay. Okay.
But even when I'm not talking, I'm still hearing these other noises, and I don't know how to describe it.
Okay. So when it's quiet and no one's talking, you're hearing noise in the background also? Okay.
That sounds like static.
Okay.
Yeah,
Okay.
when there's nobody's talking. Staticky kind of sound.
Okay. But when we start to talk, then the sound
Yes.
that you're hearing
You hear-
changes.
Yes, the static sound I hear, but then the robot
Okay.
kind of
Okay.
comes in.
Okay. And that's, I think, how it is normally in the beginning, like
Hopefully
what you're
it'll kind
describing.
of just slowly converge into normal sounding speech.
Yes.
To
Yes.
normal sounds.
Yes. You have to stop and think that, you heard a certain way with your hearing aid. Your hearing aid gives you what we call acoustic hearing. So it takes the sound, it makes it louder, puts that louder sound back into your ear. This is an electrical stimulation. So this is sending an electrical signal up through your ear, through your auditory nerve, through your brain, and asking it to hear a whole different way, some way it's never heard before.
Prior to this, Mary Beth, I could understand you just like this, and this is really the only kind of environment where I could understand
Sure.
speech well.
Sure.
Quiet, one-on-one, 2 or 3 feet separating us. You put me in any other kind of communication situation, and I was struggling.
Yes.
I might have been able to hear the voice, but not understand what was being said.
When you listen with a hearing aid, the optimal distance for listening is about 4 to 6 feet, so it's very close. When you have a cochlear implant, typically you will listen not just at 4 to 6 feet. What that does is make you a very good incidental listener, which in turn makes you a very good incidental learner.
Before I had the implant, I had great difficulty with conversations.
You had to have his attention before you spoke to him, and generally you would have to face him directly so that he could read your lips. And many people would speak very loudly.
The implant has changed all of that. And the only complaint I have now is especially the people I work with here shout at me all the time.
He would say, "You don't have to shout." I said, "Okay, I'm sorry, I forgot that you can hear now."
And I haven't been able to train them yet that they don't have to do that anymore.
How has the week been with your cochlear implant?
It's been good. It's been kind of interesting. I have experienced some subtle changes in which I think my brain is starting to make the connection. I've noticed a couple of days ago when I sit in my rocking chair at home, instead of sounding like tinnitus, I'm hearing a slight creak as I'm moving.
Well, what we want to do today is hook up your processor to the computer, check your impedances again, and then double check the levels that we set last time, maybe make some adjustments to the sound of my voice or your voice and see if we can make it better or make it any more comfortable. So how does it sound now in comparison to how it did when you came in? Is it better, louder?
It's probably a little louder.
So this sounds pretty good to you then, relatively speaking?
Well, if a robotic sound sounds pretty good. Yeah, this sounds pretty good.
Okay, I think we're right where we should be for 1 week after initial hookup.
And I think it's been a good week. I'm excited. I can't wait to see what's going to happen.
Good.
I feel good about it.
As the boys get older, I have no reservations about them being able to do this on their own. Cooper 3 months into it to put the magnet on. I just think education's a key on it. I love it when an older person comes up and asks, well, what is that? What happened to him? Well, he just born deaf, and that's how he hears. It's Dolby Digital, I tell him. I say, hey, it's like sitting in a movie theater. He hears better than we do. One of my concerns before was, is he going to hear the same way we do? But he doesn't know how I hear. So why does it matter how I hear compared to what he hears? What can happen is you can consume yourself with, well, can he go down a slide? Can he play? But you worry about that anyways as a parent. So I guess concerns you would have would be like any other child growing up. Any child that could hear. You appreciate what you have so much more, and because of what we did with the implants, they can hear music. That was one thing we were afraid with our boys. Are they going to be able to hear music? I'll be singing in the car and Isaac will be singing right along with me. And, you know, eventually someday he'll be able to go to a concert and turn down the volume, stand right next to a speaker and be like you and I talking. You know, that's the technology.
So it's been 5 months since your initial stimulation. How have you been hearing since our last appointment?
I'm hearing fine. I have something kind of exciting to report.
Good.
I was in church, and ordinarily in church, I sit right up front. I'm using FM equipment to help me hear. And I was acting as an usher that day, so I was in the back of the church. And as I was sitting there, I was able to understand everything without using any FM equipment.
Okay.
And he didn't sound like Mickey Mouse. So
well,
that was
that's
good.
even better, yeah.
Yes, that was good.
Yeah. So it sounds like you're making good progress and everything is going just as we would expect it to, improving as time goes on. And I think one of the things we showed as far as your improvement is when we tested you back in April of this year, which would have been 3 months after your initial stimulation, with your cochlear implant on, you were able to understand some sentences without any visual cues, just by hearing, and you had a score of 77%. And then when we added your hearing aid back to your right ear, you had a score of 97% on the same sentences. So we know that you have the capability to pick up the sound. It's just kind of now, as you're saying, kind of get used to hearing those sounds and using it to your advantage.
I definitely am hearing sounds that I have not heard in the past. I love hearing the birds. Love it. It is really cool. Definitely it's been a worthwhile experience. I mean, I have absolutely no regrets whatsoever. One thing I've noticed a huge improvement with Mary Beth is talking one-on-one with people that in the past were notoriously difficult for me to understand. Whether they were mumblers or very fast talkers or whatever the situation was. I can understand them much better. Oh, you know what else happened? I was in a movie with my daughter Jenny, and so we're sitting there and we're waiting for the movie to come on, and she's whispering to me, and I actually understood her.
Great.
I'm like,
That's
you
pretty
realize
good.
I would never have understood you in the past when you were whispering to me.
Right.
But I was able to have that whispered conversation with her, which was really neat because
Yeah.
I've not been able to do that before.
Sure.
So that's, you know, those types of situations are the situations that I've noticed a tremendous improvement. You know, the bottom line is, with my hearing loss, my world became so narrow. I have so often tuned out in the past because I would walk into a difficult situation and give up because I couldn't understand. And so now I have to kind of, I guess, retrain my brain to focus and pay attention and concentrate.
That's what we hope for. We hope that you'll be able to participate in more situations where you kind of pulled back or withdrawn from before, now that you have the implant. After looking back over the 5 months and everything that we've done and the testing and everything, I would say that you're doing very well. As I often tell people, it's a process, so the process will continue. And we just hope for the best, that one day you'll, be able to watch that TV without the captioning and understand voices and know what all those sounds are and everything in your environment. But I think you're doing very well, and I'm very hopeful for the future.
I am too, and like I said, even if it doesn't improve, it was, even at this point, absolutely worthwhile doing. Absolutely.
Good.
So I'm very happy.
My overall experience with Dr. Turner was very, very positive, and we were very grateful to him and all of his team. They're top notch. You want somebody on your team that's going to make them hear. That's all it's all about, is just being able to hear.
I feel like we have a really good relationship. We don't see him as much as what we used to, only because fortunately Isaac has not had any ear problems. Every time we do see him, he's great with the boys.
They hear. they hear. That's all you can say.
I want to be able to understand people when they're talking to me. That is my reason for moving forward with having this surgery, so that my understanding is improved and my ability to stay connected to the people around me will be significantly improved. Because the bottom line is, it's very frustrating for the people around me too when I can't hear. Not only does it impact me, but it impacts everybody.
When we see the candidate who's lost a hearing over time, and they're there with the family, and you're having a discussion with that family member, and then you do the implant, and then you see them back, let's say 3-6 months later, when they've used the implant and gotten better at using it, a lot of times you see these people are just completely different patients, completely different patients. I had one patient who, when she came with her family members, she really couldn't interact. She would just sit there, sort of almost looking depressed. We implanted her, and after she started using the device, she was just full of life, and you would never know that from that first consultation. And you don't want to sugarcoat anything, but you see that often, and patients come in and their families come in and they are incredibly thankful because of the fact that they got that person back. You know, especially married couples that have been living together for years, you know, and they probably knew what that person was like when they, you know, maybe certainly had less hearing loss and were functional with hearing aids, and all of a sudden, you know, you're able to help them and restore that, and you see frequently a huge change in those people.
And I don't think people get it. I don't think they realize how devastating the impact of hearing loss is. And that's what's so wonderful about a cochlear implant, because it opens up our world all over again to being a hearing person and to be able to stay connected with the people that we love.